few weeks ago, I shared with you an update on a forgiveness program, loan forgiveness program we have for physicians. And today I'd like to share with you the second bill that'll be coming out this week that'll deal with healthcare shortages that we have in our state. We have a bill that'll be introduced this week that does basically three things. First off is to address the doctor shortage in our state. We are looking at adding additional residency slots in our state. Residency slots are the training opportunities that doctors have working in hospitals and clinics. And it's managed by Medicare, and so you're limited on the number of slots you may have. And as we face a shortage here in Minnesota for doctors, we're looking to add 14 residency slots in the state in critical areas that we know we have shortages upcoming. So we're looking at adding 4 primary care residency slots. We're looking at adding 4 psychiatric doctor slots, 2 slots in general surgery, and 2 in geriatrics. And this will provide us then additional training opportunities for doctors, hopefully, that will stay here in Minnesota once their training has been completed. The second piece of that bill deals with preceptors. Preceptors are the folks that help train the doctors and nurses in our hospitals and clinics. They are the supervisors, the mentors that work with folks that are finishing their licensure process. And we have a shortage of preceptors in our state. Part of this is because they are busy as trained professionals working with people, and this would take away from their opportunity to work in clinics while they're working as preceptors, helping training doctors and nurses. So we're looking at a financial incentive that people could receive if they would agree to be preceptors for a certain number of months during a year. And then the third piece of the bill deals with clinical opportunities. Doctors, nurses, many other health care professionals, in order to be licensed, have to spend a certain amount of time or hours in a clinical training experience. We have a shortage of those facilities in our state. These would be hospitals and clinics that agree to take on trainees. And so what we're looking at is to provide funding to expand programs that are currently in place that provide clinical experiences, or if there are institutions, hospitals, clinics that do not currently have a training program, that they could start a program. And we would provide, as a state, 4 years of funding for clinics and hospitals to take on that responsibility. So that's a bill that'll be coming up this week, and hopefully we'll be having a hearing the following week, and it'll be moving through the legislature.